Welcome to the meeting. Call this meeting to order. Will we do a roll call?
Sure. Director Stanison?
Here.
Director Leach?
Here.
Thank you.
Do we have any public comments online or in person? No.
We do not.
No, I received nothing via email. We don't have anyone else on Zoom.
All right.
Everybody's afraid of the weather that's about to hit us again.
All right, we'll continue moving forward then. Let's get to the discussion items. Teresa, report on the Health and Wellness Center.
Okay, well, I'm going to give you guys just like some quick bullet points about, again, lots of the things that are happening there. But then I also wanted to take a minute to go back and fill you in on how we're getting our direction and priorities for what we're developing there. So I'll just jump in now. So in March, we had a total of 80 events. So going strong, 61 public and 19 private. The next thing I want to bring to your attention is the Community Resource Navigator. So Kathy is doing a great job of getting connected, and it's actually great exposure for us and our organization, because we have something new to offer. But as she's reaching out to these different organizations, we get to remind them of everything that we're doing. We're making good connections. So some of the groups she's met with is our grantees. We've met with 211, the County of San Diego, Veterans Administration, the VA's office, our local community clinics, some of the groups for migrant services, Farm Workers Care Coalition, Interfaith, Live Well in San Diego. So it's been nice. And so she's had instruction kind of on our messaging and how to represent us, as well as she's out there, talking about what she does as well. So in terms of the county, we did go to a new meeting for us, the Live Well North County Leadership Team meeting. So it was very nice to be a voice for North County there and talk about some of the challenges and needs that we have here. So that's a meeting we'll continue to have a presence at. We are underway for our lifestyle change program. So me and Bianca are CDC trained lifestyle coaches now. So that's great. The other way that we're engaging through the community with this is the building of a physician referral program. So we have started going out to let the local physicians and groups know about the lifestyle change program, how it can help patients with prediabetes. And the vision with that is this is not just for this one program. This is for all of our programs. They can become aware of support groups that we have, and they will have the infrastructure to refer people. We'll be on their radar. And as we move forward for some of the future programming that is more health and, disease-based, we'll have that established with the doctors. So we're learning how do they give referrals, who do they interact with, so that we can have that good partnership. And that we got our first referral yesterday from a doctor's office. So we've only met with one of them so far. The other meetings are oncoming. Nice. So we have about 12 serious candidates for the program, and our goal is 20. So I think that should be good. We're doing really well with that. One of the things that we did is we do have a page on our website now for the lifestyle change program, and it also has a physician's referral page, and we have a referral form. So a physician or organization, so some of our grantees, if they have individuals that could benefit from that, they could do a referral, and there's an inline, in-page form, or you could download and fax back the referral form. So we have a couple of ways. So that is all up and ready to go. And even our local village pharmacy is so excited about the program. They are putting in, I don't think they've started yet, but they're putting messaging in all their prescription deliveries about the program. So it's got some nice, everyone's very excited about it. And you can even see that when we move on to social media in terms of how some of those posts are doing.
Quick question. So I think that's pretty cool. Is there some sort of a leave behind piece that they keep to kind of connect and maybe hand out, or don't we at that point yet? I'm just not sure where we are.
No, we do. We have flyers that they can put up in some offices,
Yeah.
have bulletin boards in the office, as well as give the patient. So when we meet with them, we give them the hard copy referral form
Right.
and a page for the patient as well.
Okay,
If they go online and do the inline form, it says to print out this page to give to the patient. So it has just an overview and our contact information
very good.
for their patient.
Okay,
And, or they can take the whole package and it's a PDF and it has the page with the referral form and the page for the patient.
great.
So, yeah, and then we are also having some informal discussions called coffee talks. So they have those flyers as well. So we're trying to meet people where they're at. Are you ready? You can connect at a coffee talk, small informal group. You can come to our Wellness Wednesday, or you can schedule one-on-one with Bianca and all that. Those 3 options are on the website page for people.
Excellent.
So it's going to be great as we move forward too. It's a lot of work now,
Great.
but it will pay off for a long time as we, for future programming. It'll really be great.
Okay.
So that's kind of, the big pieces of what's been going on at the Wellness Center. So now I kind of want to just like kind of take a step back to fill you guys in on why, what are the programs we're choosing and how our efforts are being determined. And that goes back to, as we're doing our program, to the strategic planning document. Pull that up. So right now, so this was a document and we've been using that as our direction. So there's a few different goals on there. The kind of like the third goal down is the diabetes prevention program. Bringing that underway, getting that underway. So the strategic planning document also works with the catalyst, and I'll briefly go over that. So the catalyst report called out different programming, and then the board met the strategic planning committee and came together with what are our top priorities. Diabetes is huge, pre-diabetes is huge. So therefore, that was one of our goals. And so that's why this is such a big push for us to make sure we hit that goal, for the year. And it talks about it having a youth and family focus, and we are able to do that through allowing through families. So it would be more of a family thing. If they have an older child, the child could come in to audit the program, or a parent could come on behalf of the child and audit the program, is how we were able to meet that goal. So we're developing the referral pipeline. So, and we're, this is the pilot year, so we're keeping in mind that we're going to keep really good data so that we can evaluate it and see about moving forward with it. And what we're using for data is we're getting connected with a platform called Unite Us, and it will allow, it also will come over to our community resource navigator, because you can do referrals both ways. So doctor's offices, let's say if someone's doctor participated with an out of Fallbrook doctor and they wanted to refer through Unite Us, the referral would come right to us, to Bianca. Same thing if we wanted to refer out to different programs, Katya will be able to refer out. So it's a really nice platform that we're able to do through the training we've had through Skinny Jeans. They set that up for us.
Right, so I'm gonna just quick background. Catalyst, when they did their community needs assessment, diabetes was the #1 problem. They then called out this diabetes program. We researched it. We're connected to Skinny Jeans. They were the original group in San Diego offering the CDC program. They then received some grant funding from the county to do this pilot program where we got selected. That's how our group got connected in there.
Yep.
They're the ones helping us get connected to this Unitas and some of these other processes. So just that little bit of filler data in the back of your mind.
That was good.
There were 5 organizations selected, but ours is right now is the only one that's registered with done their registration with the CDC, has a start date, has a lot of these pieces in play, because it's it's a big project.
Yeah, for sure.
So some of the other goals, and on page 2, of this. The second one down is 2 signature community events, with the success indicator being having at least 1 event. Since we weren't sure what was happening with development and construction, we do have 1 event targeted. It's for families and children. It's going to be a back to school style event. We're going to have health trainings, resources, check your car seat. We're going to involve the sheriff and the fire department. We are still in the works of scheduling it. We've reached out to a few partners. We're finalizing the date.
We're looking at that September 30th date.
Oh, that's
now.
right.
Yeah. So the Lions Club does a big thing throughout the county. It's called their Gift of Sight program. And it's where they bring eye physicians of various sorts to do vision screening. And then they also can provide the glasses for a lot of different kids and families. And it's all completely free. They don't do that on a constant ongoing, because obviously it's labor intensive. So they just got back to us with that date. We were just able to confirm the September 30th date. Okay. So we'll partner multiple events on that one.
Yeah.
And then I have another one that I just found out that I'll fill in on later.
I know which one you mean. Yeah, I'll let you talk about that. So we have that underway. And so those were, on the front page, I forgot, there's page 1, says that one of the goals is to provide no less than 3 ongoing programs that address social determinants of health needs. So we have that. It specifically was called out more mental health first aid. That's what MHFA is. So we do have several more scheduled for the year, including veterans, older adults working with youth. And then we have one happening next month that's targeting healthcare workers. So as we're doing the physician outreach, we're also able to invite their staff to come to this, and we are training the San Marcos School of Nursing students that come here and do part of their community nursing work here in Fallbrook. So they're a part of that group. So we've done even more, we've expanded quite a few. And then the other one was to explore financial literacy. And so we do have that, an initial workshop coming up in April, because it's Financial Literacy Month. Plus, we are going to be doing some other workshops, and Catalyst had called out a partner in the county to work with, and they have some really cool programs, including like one-on-one help with people with a true financial professional. So down the line, there's some really neat programming there that can help, and there's such a link with that, and and our health. So it is a way to support families' health. The other program that was called out was mindfulness. And so we do have all the intelligence gathering and research started for that. And I'm going to be presenting, Rachel with more information about those programs to get that started this year. So we're on track to meet the goals that were outlined, what we were following from this strategic plan.
And that was in 2021, that plan? Is that
no,
correct?
that's for this fiscal year, 22-23.
Okay, I'm just, because I know there was a gap there somewhere. Sort of.
Yeah, everything that was pre-COVID or COVID was all 100% focused on that. So last year when we were developing the 22-23 plan, obviously there's a lot that was based on an expectation of construction at the Wellness Center. We're now halfway through that fiscal year, right, but we have a completely different shape of where we're going with the development. So what we've really continued to keep our focus on is that programming piece, because that makes the most sense right there.
So just if you on the screen have pulled up what was provided from Catalyst. So they not only did the health research to what are the needs in our community, then they got the board interaction of what were the priorities set by the board, and then put that together to come up with actual program recommendations. And so this is where we're starting with what programs. So in some cases they call out an actual organization that offers that program. In some cases, you know, we may have to build our own. So these are like little one-page overviews. So right now we have 4 of these planned programs from Catalyst. 2 are running, which is the mental health first aid. And the instructors from that are through the county. So we're lucky because there's no cost to us. They've been great partners. And to date, we've trained, I think, around 130, 135 people in the community for a mental health first aid. I think that's the number.
Just a quick question. Can you maybe explain a little bit more about what that program's like and what they do? Yeah, I appreciate it.
So the whole training is 8 hours, and you do get a little certification at the end for completing it. Yeah. It's based off international. Mental health first aid is international. It started in Australia, and it's gone throughout the world. And what it does is it helps one with awareness of mental illness and mental health. And it goes through and explains kind of, you know, what to look for, what people experience. And it's not just, although it does talk about schizophrenia or bipolar, which are less common, it also talks about anxiety, talks about depression. And so what people are going through, what to look for, what are the signs that someone is having these challenges, and then how to help them.
Okay.
And
like breathing techniques or
no, it's not designed to be a mental health service to you. The idea is it is train the trainer style.
Yeah.
So it will bring forward some very basic services so that you as an individual, whether it's for your business, your home, whatever, you'll be alerted to and given some basic information on how to spot and basically interact with someone who may be having a mental health challenge.
Okay.
So from that top layer, then they have certain modules that can be more specific to healthcare providers, things of that nature. So the idea isn't really that it is providing you mental health services, but to provide you with insights into what to do, how to recognize, and then how to take next steps.
Especially if someone's in a crisis, you know, you're going to have the tools to help them. What do you say? What do you not say? Where do you get them help? How do you evaluate like exactly the level, you know, of, you know, how serious it is.
Sure.
So, and it's very dynamic. There's some great discussion. There's some different activities you do during the class that really keeps the interest. 8 hours is a long time, you know, but they keep it very, engaging. And we had great feedback.
Do they typically do it just all in one session then, 8 hours in the one day?
We break it up. So we'll do some on a Saturday, 8 hours, some on a weekday, 8 hours, and then 2 evenings. If you go more than 2 days, you're going to lose stuff if you did from 1 week to the next. So sometimes we'll do 2 evenings and we rotate it to try and accommodate different schedules.
Awesome.
But it is one 8 hour block if somebody would sit through. Gotcha.
Yeah, or we'll do 2 evenings in 4 hours.
2 hours.
So we had them come up and they did it for the staff before we really launched it to the community. And we chose to go with the 4 hour blocks. There's just a lot of information. They provide a nice little booklet. So it is really good for whether people are coming in at entry level, and then the modules for folks who may come in with a very specific skill set, right? So they are developing some for teen focus. They have some first responders focus. So the idea is that this curriculum is already set. We don't have to develop it, and they can bring those trainers for that.
Awesome. Thank you.
So it's a good program. In terms of engagement, we weren't doing early on, like where we had everyone get their picture taken with a koala, that's the mascot, and then have people go on Facebook and share it out. And we didn't have as much people sharing it as we would have liked. So we don't do the individual photos now, because that was a lot, but we still do, put, these are the graduates of the program, do pictures and stuff. So so the National Diabetes Prevention Program, that's underway. Mental health first aid we've been doing for about a year. And then the other one, that we have that was called out to us in the strategic plan is the mindfulness-based stress reduction. And I'm not sure which page that is. And so that's what we're, researching and will bring forward as the potential. That one does have a cost to it. But it is, not only does it help with stress reduction, but it's proven to help with a lot of health conditions. So it has more of this health medical outcome focus to it, and has been very, as a program, very researched.
It had a good tie-in for a lot of the problems with our hypertension folks.
Yep. So those are, and then the financial literacy is the last, I think it's the last page. And so this is one that's offered again through a county type organization. So where the training, we're able to get that and bring it to Fallbrook at no cost to us. So, we do the marketing for it, we provide the space, but the instructors come to us like mental health first aid. And so that would be nice. It has a lot of different workshops that they have a lot of different, where we can do workshops or one-on-one. There's a lot of different opportunities there over the course of time to build that program out.
And we expected that at some point we would tie this one in with some of our various nutrition and demonstration garden programs, the idea of how to take what you're growing and what's seasonal and build it in with your shopping list, so that big part of your budget, especially right now, is going to food. So that was one additional growth point from a lot of these programs. There was an expectation that the first set would hit the highest priorities, but would also be priming the pump for the follow-up build-on programs.
So what's your sense of the awareness of people of these programs in the community?
Well, since the diabetes program, there is a lot of interest in, because we haven't launched it yet. We couldn't really promote it until we knew it was coming and what the training was like. Mental health first aid, because it was pre-packaged.
Yes.
As soon as we launched it, there was a lot of energy around it. Same thing, that one of the first programs we were able to do was Mary Murphy at North County Fire was doing our sidewalk CPR programs. Again, lots of flurry of interest. What's the overall percentage of the community knowing that it's there? Still pretty small.
And how do you bucket these programs? Is there a kind of an umbrella name for all these? Is it
the Community Health and Wellness Center?
Okay, that's what I'm, so it's under that umbrella.
It's all
it's not a core or a subset of.
No, because they're district programs, they're under our name. We're not really promoting the entity putting it off like a Michelle's Place or something like that. We do all the marketing, if you will, around this from the health district, from the community center, blah, blah, blah. Is that?
Sort of. So I'm not looking to promote the other, I'm more thinking about, this is nicely packaged and communicated right here. I'm thinking about the pillars that the wellness center is going to be delivering. There's food, nutrition, health. Is this a standalone set of things that are common in a way, or is it just kind of the ones that are working right now, but they fit under a larger? They all fit under the basic community's health and needs assessment that we did. Okay. So that's a clinical sounding kind of thing. So we didn't,
I think what you're identifying is one of the challenges, for some of our stuff is how, what do we put that? Some of them are disease management, some of them, but, then you're thinking about public facing to, put a little bit of color on it, make it, interesting. So, and how
I'm rewinding back all the way to some of the things that get said and reported that are either correct or not correct. But when you see something like this presented this way, it's much clearer to me of the opportunity and the success that we're seeing and how this could potentially grow even faster. So how do we package that?
Technically they're health promotion and disease prevention programs. it's academic, I know.
Yeah.
No, I get it.
4 pillars that target the social determinants of health, like these are the ones that assist or help, or what's the word?
We can chat more about it. I mean, because I want to just get more into the, I want to see all this stuff.
I
kind of
know
how
you
it
want
plays
to
out.
Smith the.
Well, no, it's how to make this very communicable to somebody who doesn't have any idea what that building is, to where do I fit and where do I go, right? So I've got this issue. And wow, there's a lot of opportunities to get it resolved here. So I'm just wrestling, as we've had our discussions, and we continue looking forward of how do we package it, so that we can make it real easy for people to jump on this stuff and go after it.
Yeah, I think a lot of this ends up being in the piece of the more the clinical programming that we're offering or whatever versus some of the stuff that maybe some of the partners are doing or whatever. So,
And it could be packaged that way, that, you know, partner programs, district owned programs. I mean, there's different ways to parse and slice and dice, but again, coming back from a community person looking out into this, where do I fit? How do I get it?
That kind of like we look at it as three things. You have like our district events, partner events, and private events. That's kind of how we, you know, internally think about it and talk about it. A private event would be like some of the clubs that use space there. Our event is something that we're actively responsible for marketing, like diabetes or mental health. Partner events would be like Michelle's Place, and they have a cancer support group. You know, so,
all right.
You know, and they're all out.
We have a chance to meet with.
We can, I know what direction you're going. But my main purpose for sharing this with you today, so that you guys know where we're getting our direction from. We're not just picking things, you know, or, you know, come with things that it came from the Catalyst report, and then the board, you know, honed it in and gave us some direction. And also to let you know that, you know, we're on track for, you know, achieving that this year. So
got a plan and execute it.
We're
plans may change, but process is there to make it happen. That's good. Excellent.
So I'm gonna go back to the report. Gotcha. So we're working also on our Wellness Wednesday events. We have we'll present later what the topics are, you know, for the rest of the year, but we have that all pretty much solidified. So there's a workshop with each of the health screenings and different resource providers. So it's not like meant to be a resource fair, but different topics and different things that we can bring to the community at the Wellness Wednesdays. In terms of our meetings, we're continuing with our Engage campaign, which is an ad in the newspaper and then our social media posts inviting the public to come and participate. We also are continuing our Grants in Action campaign, which is meant to educate the community about the different grantees we have and let them know about a community health grant program. So the rest of the report is kind of the numbers. So I'll call out, you know, for the, you know, in February, we had, you know, approximately 781 visits to the wellness center. So it's continuing to draw on more people. We still are continuing to do the flyer distribution or continuing to grow our email marketing list, which is just really amazing to me that it continues to, you know, go strong with so many new emails. And then, you know, the social media continues and, you know, you can see, well, I don't want to take away any of Danny's time if she wants to address the social media.
Hi, I'm surrounded by dogs, so I'm not going to put my video on. Just a couple of quick highlights. I know we have a lot to cover. Mainly, it looks like our Facebook engagement is doing really well at the moment. Unfortunately, Instagram is just not meeting that same growth, but we do continue to grow in followers on both platforms. Some notable posts are going to be the coffee talks. As Teresa was mentioning, there is a lot of interest in this program. So those posts are doing really well as the Ballroom RX. Anytime we post about the class itself and they see people dancing, there seems to be a lot of really good engagement towards those posts. And that's pretty much it for me. If you have any questions, let me know.
No, that's good. Thanks. We'll dive into that, I'm sure, coming up as we frame a strategy. But I was just wondering if we tested a 10-second video of the people dancing, how much of an impact that would have.
Yeah, so kind of one of the difficulties with me being in a shared position is that I am based out of the North County Fire office because I also serve as the receptionist and intaker for the plan check. So unfortunately, I can't be on the campus at all times to do a lot of great fun videos and pictures. A lot of times I am depending on the staff to be able to snap a picture in between everything else that they have going on. So I do try and remind the staff every morning when I do know that there's a good event that I think is going to be very receptive to the public. So it's just about me being able to communicate and say, hey, this is a good event. Let's get some pictures or videos going.
Good. Sounds good.
Just to note, the other challenge with some of that stuff is that we run into is, do people want their pictures taken? And depending on what you're in, if you're in RX Ballroom, you have, you know, Parkinson's or maybe dementia. So we try not to, you know, although it's been fun, some people were noticing, they said it was okay, but we always have to check with people. But same thing when people were at some of the health workshops focusing on like sugar, you know, like more like sugar kind of things. Some of the people do not want their picture taken. So sometimes we're forced to go on the back or, you know, try and do something a little creative.
There's a privacy aspect for sure. Yeah, I understand. Yeah. Okay. Sounds good. Thank you.
Thank you.
Is that close out?
Yeah, I think that,
all right.
Yeah, unless there's any questions.
So we'll move on to the next one then. So I'm going to do a quick debrief of the meeting we had last week with the staff.
Do you want us to pull your slides?
Yes, please.
Got it. Okay.
I won't go through this. I'll go to a pretty high level. We had a great, it was almost 2.5-hour meeting. It was very well engaging. Everybody was very active in communicating. We had a really good discussion, actually. I was really impressed with it. And the agenda we wanted to go after was, you know, kind of talking about, you know, what's going well, what's not going so well, some historical perspective, but I didn't want to spend a lot of time on history, though it's helpful to learn how we get to a place, but I wanted to really say, you know, how do we move forward and what does awesome look like going down the road here? So kind of looking at current work, who's doing it, grantee actions that are in place or should be in place, touched on the 3 communication pillars, how the district engage with the public. And then this last one was just, you know, kind of this revenue slide, which we have in front of us now, which is awesome. Kind of just I was curious about how grant and admin changes over the last 5 years. I think it's a good baseline. It's a part of a communication and people have questions. It's a very easy way to look at these types of things. So on to the next slide. Historically, we looked at a lot of milestones that occurred over the past 20 years. It's always good for me because I'm new to understand all the fun and games that went on leading up to this point. Multiple CEOs, board members, staff members. We've had a lot of changes over the years and certainly accelerated over the last 5 with COVID added to the mix. I was wondering if there's a possibility of a historical milestone chart as we were talking through all these things. There's some interesting things that happen over time that kind of directed and changed direction. And just wondering if it's a 1-page chart or something that might be just, and we may already have it, I don't know. But it hit me when I was putting this slide together of, you know, kind of the historical benchmarks that occurred that led to today, how we got here. It's always very helpful for people, I think, to understand that. Next slide, please. So some of the challenges we discussed, obviously the newness of the staff, there's a lot of new people, a lot of changes going on. It's fast-paced, near-term, action-driven environment, which is fine. That's where we are today. It's not a problem. It's just the reality of where we are. And seeing what you just presented, there is basis for it. It isn't a random event that's occurring. There is a structure in place. We are moving down a path based on set of strategic imperatives that were placed before. But it does point out the fact that this is pieces of parts of people's jobs, and it isn't contained in one central location. Now, resources are limited because there's day jobs going on, and the marketing side of things is being done as best we can, but there's other work being done too, that we have to continue to do. You know, obviously the continued focus on Spanish language resources at all touch points, webs, events, you know, that's something we always continue to strive to do. And how do we do that more effectively and continuously improve? Social media strategy, again, we just touched on this a little bit. Event capture, video marketing, upcoming events. It's something that has to almost become front of mind. I've had to personally learn this in my business because I didn't do this before, but anytime I go somewhere, I have to remember to take a picture or do a quick video to say, here, I'm engaged, here's some fun things that are going on. And it just becomes part of how do we grab a little bit more of that, 20% more each time we do this, just to give us content and things that we can start moving forward. And we talked about the cross-linking of the grantee and our websites, what they can and can't do, what they could be doing, can they do more if they get grant money? How do we get them to, you know, cross-link our sites so we're programming and, you know, promoting each other? Is there some other things that they can do on our behalf as we expand our partners? They become mini marketing departments for us. How do we utilize that more effectively? And then the end of this whole discussion, it really came down to a strategic plan needs to drive the marketing objectives, not the marketing objectives driving strategic plan. So I was encouraged to see that we have a workshop coming up to talk about strategic planning. I will be bringing in a lot of questions around the driving of the marketing objectives as part of that plan. So the plan will, we'll get the directions and where we're going to head, but then from there you build a marketing strategy. So we don't want to get too cart ahead of the horse. We do have to have that first, but then right behind that, we've really got to drill down on what we're going to kind of do from a marketing perspective. Next slide. As I said, we had a lot of discussions around this. I know there's been strategic plans in place. We just have to go, I haven't been through the process, so I'm anxious to kind of go through that and see how that lays out. But that has to really become our number one objective over the next few months to get that nailed down to a level that I think we're all comfortable with. The tactic-based objectives and short-term focus and actions is in place. Again, not a problem. It's more of an observation. But getting a little bit ahead of this will be very helpful in terms of, so we're not doing repetitive work that's not adding value. So I think that's kind of how we got to balance that off. And I add that bullet point, which is very important. Each action should point to a strategic objectives and or strategy. So anything we're doing, any person in the organization should be able to look at what they're doing and see how that heads into a strategic objection or strategy. Last years have been difficult with COVID. We know that. A lot of great stuff going on, even through the pandemic. I think things that you probably never dreamed of having to be done, got done. And that's a credit to the team and the flexibility and the resources that we have, which I was very impressed with during the meeting. So again, areas to consider, vision, mission statements. We probably should take a look at that, see where we are, if they still make sense. If they're
Strategic planning actually just has that on their agenda.
We've been looking at some of these things over the last couple of months.
Good.
That's one of the things that we've been kind of kicking around. So
good alignment. I love it. These are things that popped out as I was having this discussion now, but it's all good stuff. Service delivery through own resources and grantees, the coverage map we talked about a little bit, even a web page flash that has the map of where they're located. You hit it and boom, here's what they do. Here's how you get a hold of them. Here's how you get help. It's a great way to visualize what this is on a physical map. The urgent care franchise business model discussion. What does it mean? Because it's a question we're going to get. Why don't we have an urgent care? Well, here's why. It costs $3 billion and takes 20 people, and you got to have certifications, and you got to have 80,000 people in the metro to make it work. Okay,
that's problem solved. Close to what we just talked about, isn't it?
Yeah. The partner roles, co-funding models, again with the other organizations, expanding, taking advantage of, utilizing, whatever that might be. But I look at an opportunity to reach out to some of these folks and see, what are they doing? How do they do it? How do we work together to maybe expand 2 + 1 + 4 is much bigger number. And then public outreach, obviously this committee has got a lot around that, but what are the marketing, social events and grantee driven objectives that can help continue to grow our awareness and the outreach so that people know what we're doing and they feel comfortable what we're doing. So next one. We just had another bunch of things that kind of popped up as I just captured on a slide here. We talked about the webpage, developing the maps of services, the grantee services, clickable directions, summary of service. I mean, all those things I just envisioned having a nice drop down box of seeing what they offer there. I think the grant site visits more frequently, how we can all benefit from that, learning from them, hearing their concerns, their questions, their challenges, because I think that will ultimately help drive some of the things that we could potentially be working on. I love quarterly success stories. You know, I hear them in here, but I don't know how much the public hears about them. There's a lot of cool stuff going on. So how do we just make that a process that sticks and keeps going, so that we have, you know, whether it's a newspaper ad or a web face or current event, a quick coffee talk, you know, quarterly successes at each of those organizations would be really helpful. Grantee marketing expectations. I'm not sure how much we can push on that one, but I'm always going to ask the question, especially since we're throwing some money at them. How do we, you know, how can they help us market each other? I think that's really going to be good. Obviously, participation at community events. I'm looking forward to the ones coming up here. I think that'll be fun to hit that and be part of it and just see, you know, what's happening. Yes, and the last wellness center definition and marketing. So is it a venue? Is it not a venue? But you know, you hear all these things that are happening. And there's obviously, based on feedback we're getting, it's not sticking. Something's not just hitting all the way, and what could be done there. I don't see it as an issue. I don't think we're stepping over any other organizations. We have a process to make sure we don't do that, but just making sure people are comfortable with that. So, and then registration automation. I'm capturing names as many as we can, as often as we can. Next up. And then I just kind of wanted to document the pillars of communication that I continue to focus on until I find a better way or somebody tells me I'm stupid. You know, that's all I'm looking for. But I do believe that these are the ones that keep coming at us. And we think if we put a little effort in getting those nailed down real tightly, why the hospital went away, where's current urgent care, what are the hurdles for adding a new one, what does this district do, how is the grant money spent, what are the categories of money? I mean, this is a great first start. I mean, this right here is very powerful to show that, you know, things aren't going like this out of control. There's a trend. There's a pretty stable, consistent set of percentages. That should make people feel good that it's being managed consistently and effectively. And then what's the next 12-month plan of action? You know, I think the strategic plan will then come out of that. It'll be, okay, what are this year's objectives? So, like I said, it was a great conversation. I had a great time. The meeting was fun. Everybody participated really well. Got a great respect for the staff and their knowledge set and what they bring to the party. There's a excitement and an energy around this. So I think it's an opportunity to just accelerate it and keep going. So that's my report, and I'm sticking to it. Any comments? Anything I might have missed, or anything else that we should bring forward?
I think I would just echo the same thing you said. All the staff were engaged. It was nice to be able to have so many new staff be able to bring forward all of these things with just an outline of, okay, here's the history. And then, oh yeah, everybody's new. In the last year, what has happened? And just, that is a rocket ship, because everything has happened within essentially the last year and a half. But, you know, the year before that, year and a half before that was just all COVID of all things. And before that, most of us weren't here. So in some ways, it's really nice to have a new entity. We've got new board, returning new board. It's a nice thing. So I think the staff has all indicated they felt kind of the same that you echoed, and I don't need to be everybody's voice, but if anybody's, you know.
Great report.
I'm excited about, having that strategic plan out the next few years, like just from staff, like the confidence to know, okay, this is where we're going. This is, like the target. And I think that's going to be really great. And I think it will clear up some of the challenges that there might be with messaging, and how, what to say, not being afraid to say certain things, being empowered, but, and knowing that direction. So I'm really looking forward to that.
Something that I always value and wanted to hear too in this process was that there's an organization primed for wanting to have a good strategic plan.
Yeah.
That's cool. Because when you have an organization pulling for it, then you're going to have really good work that comes from that. So I think that's what I saw coming out of the meeting was that this is a right time to, really go through it and help develop it. And I want to help any way I can in that regard too, because it's so critical for success.
Yeah.
So, and I'm just going to echo that what I heard in the discussions we had was everybody's there. So it's gonna be good in my mind. So.
Yeah, and I get to sit in on strategic planning as well as this. And I think both committees are moving in parallel tracks. So I think that the strategic planning workshop that we were able to book today, I think you're going to find a lot of congruence between those committees.
Yeah, that's awesome. Yeah, we have to manage, make sure we're not dual working here either. We gotta be very clear on who's got what aspects of it. So right. At this point, me not knowing all the boundaries yet, I'm just looking at opportunities and listening to what you're hearing.
I think that's good. I mean, I think you're right with as far as the strategic planning goes or whatever. I think like Rachel said, I think a lot of the stuff that you mentioned were kind of the last couple of months, that's kind of been our agenda. Hey, like the mission statement, the strategic plan for the next fiscal year and everything. But I think at its heart, the role of the board is to create the strategic plan and kind of set some of that stuff. I think in years past, maybe it's been a little bit more committee centric, but I think that, this upcoming meeting with the entire board there to kind of throw out ideas and kind of shape what it's going to be. I think that definitely, like the staff said, kind of helps them get empowered, let them know, the stability of what we're doing. I definitely think it's been a little bit of a unique challenge the last couple of years with the COVID, and then just moving into that building, having to get the major use permit, and then all the construction and everything. I mean, I think Teresa's doing an awesome job with like some of the programming and organizing some of that stuff. But now kind of coming out of everything, it'll be great to kind of sit down and say, hey, like, where's the district going to be next year, 3 years, 5 years, and kind of being able to craft a more long-term plan, because it is tough with the obviously staff changes, but even probably more difficult for the staff is that the board composition changes every couple of years, and then it's like, well, what are these board members going to want to do? Or I mean, even in the future, they could, I guess, change strategic plans and everything, and I'm sure that they will at their leisure or whatever. But I mean, at least to kind of give you guys a good plan and idea, and some longer term ability to plan and do a better job of programming. But I think that I've been pretty happy with the way things have been going with that, for sure.
Yeah, sounds good. All right, any other comments or future agenda items?
So we have a district specific event discussion, history, kind of best practices. A little bit of this had to do with just building around a lot of conversation that's come out of a couple of different committees about district specific events. That obviously ties into strategic planning. It's on our strategic plan. It was some of the things that we talked about. The main one that kept coming up was the fact that the district once upon a time had this historical health fair kind of thing. And the fact that we're moving away from that old format into this more current format that can be on our own property, that can have our programs built into it. I will let the cat out of the bag today because I got information, and Bill, you'll like this one. I spoke with Bianca, who had been working on connecting us with a group that will provide the Narcan spray. Mary Murphy will do the training. This nonprofit also provides the fentanyl test strips.
Nice.
And does the education around it.
Okay.
So that was a piece that Bill had sent me an email on and had some interest on. And I had some questions and we had some back and forth. And then I reached out to Bianca just to see if she had resources, only to find out she'd already been planning something.
Awesome.
That's what I like to hear.
So note to myself next time, let me check with Bianca first. So for June, which is National Safety Month, she has that scheduled as that's going to be the seminar, that's going to be the focus of the Wellness Wednesday event, with that workshop, with Mary doing some training and then having those supplies. She went a little further today and reached out to this nonprofit called On Point, getting ourselves basically signed up with them through state and county resources. Once they do that education and they do that training, we can get those resources from them for free. So we can continue to have those ongoing supplies. So instead of it just hit it and be done, it can be part of our regular menu of services and programs. So again, more for health promotion and disease prevention formatting. So
yeah, that's great.
a nice little piece I could sneak in since we just got confirmation on it. Once she got out of the DPP training today, she called me back and let me know on that one. So.
Deal.
And then I'll go ahead and take the May 4th and 6th for the public forums. Obviously that built out of lots of these conversations. I have some specific informational boards that I'm building out that can be used multiple times that address some of those 4 pillars. You know, what was the hospital timeline? Why did it kind of go away? Some information about what did the district do, the grants, some additional pieces that we can have, you know, understanding the property tax piece, right? People, we heard this at many presentations, people think, well, my property taxes, you know, mean I should have a full-time urgent care. Well, your property taxes give us about $1.40 per person. Well, unless we get about another 1 million people moving here, we're not going to be able to support the kind of perception. Obviously, that's not the right messaging, and that's why I'm not in charge of messaging, but making sure that it's clearly outlined. A simple one on understanding maybe why our board meetings seem fussy, right? They're not super exciting because there's not a lot of dialogue. Well, that's Brown Act. And just having that as a board so that people could walk by and see that might be helpful on different kinds of educational events. So I've got a series of those that I'm in the process of trying to make, and then I'll give them to Teresa to go to the board people, the brand assassin folks, right? So just trying to make sure that these topics that have come up from a number of these meetings, like that last special meeting, some things that have come up at strategic planning, some things that have come up from here, we can at least have some static information available.
Yep.
And then we'll help take some of that info and build it into the website so people can find it a little easier there as
Kind of
well.
core messaging. Yep.
Yep.
Yep. It's good. I'm not dying, by the way. I'm
Just dying.
allergy kicked in again.
We kind of have a rule, you're not really allowed to die in the building.
Well, it just creates opportunity for somebody else.
Listen, no empty board seats, right? No.
At least for 6 months, right?
There's somebody else in there, huh?
You have to pick your successor before you die, I'm sorry. Good neighbor.
All right. Anything else on that? Good. Any more comments?
I'm good.
I don't think I have any future agenda items except just kind of following on this. I may have another report out after we have a chance to meet a little bit more and some depth there, but otherwise we keep going.
I'll add to the governmental component of this committee. So CSDA has their legislative days scheduled May 16th and 17th. I reached out to Mike as a new board member and the chair of this committee to see if he wanted to go to that. He's not available, so Bill, I'll send that over to you to see if you're interested.
Okay.
it's a pretty hit it fast.
Yeah.
I've never gone to it here. I think we're now.
I did it with ACHD a couple years ago.
Okay.
Yeah, it's like what, like a Tuesday and a Wednesday or something. It's like fairly quick. Yeah.
I'd rather kind of do it with CSDA because I think that there's a larger pool. They capture more of the legislators.
Yeah.
As we start looking into some of these more complicated topics, I thought it might be a good idea, since we have also a lot of new legislators. I might actually take the time to go up there. At the last Fallbrook Community Forum meeting I went to, Senator Jones has a representative who came. I indicated that I might be attending this event with CSDA. And he asked if we have other special districts from the San Diego area that are going to be up there, that the senator's office might carve out extra time for this zone. So I've already reached back out to Chris Palmer, our CSDA representative. So we might try and push a little bit more of a local time zone with that. So Bill, I'll let you know what those dates are to see if you're interested in attending that.
Okay.
That would be the governmental part of this.
Yeah, and we have a tour. We're giving Jim Desmond's office a tour later this month.
In April.
April, sorry. I was looking at your calendar. That's
yeah.
In April, we have that coming up, and just being part of the North County leadership team with the county is giving us a little bit more visibility with that, and Live Well as well.
Yeah, we have a to be determined Zoom conference call with a county representative to talk more about how the local Health and Human Services office could be more usable.
Excellent.
So we are still we are still championing that effort. They have an office here. It would be nice to be able to have more of those county services available up here.
Yeah, I think when you look at what the county provides up here, it's a great argument for why the healthcare district exists and why we use the tax dollars for Fallbrook versus what would happen if the county was left, to regulate what we get up here. We wouldn't get a whole lot of anything.
Oh yeah, I hear you.
Right.
Okay.
Right.
What? No mas.
No mas.
Good.
Good to go.
I move to adjourn this lovely meeting. I will have a hammer for the here.
Well, you don't want to slam the hammer?
He doesn't like to.
Thank you.